So take us back. What was the wellness community in Tucson like when you were starting out?
Oh, I've seen it transition a lot. I think that there was a time 15, 20 years ago where people saw massage as a luxury, something
Yeah.
that they did as a nice treat to themselves. But one of the things for me that I immediately noticed is that clients would come to see me and they would be in a lot of pain. And then I would give them this massage. They'd say that was great, tip me. And then they wouldn't reschedule quickly. It would be a month out, 2 months, six
Mhm.
weeks. And then when they would come back in, they'd be as much of a mess at that time as they were the 6 weeks prior. And I started to kind of get on this level of like, okay, so if you were to come in more regularly, could we get your pain under control and keep it under control? And that's when I started to introduce a treatment plan and a wellness plan where I would recommend my clients like 4 to 6 weeks. I want to see you once a week for 4 weeks, and then we'll go to every other week, and then every 3 weeks, and then once a month as a maintenance. And as I've educated people and built my brand and my reputation from that foundational approach, I've seen the industry, especially locally, shift where people see it more as self care. They see it more as an integration into their healthcare team. We're part of a chiropractic team or a PT team. I have surgeons that reach out to me. I have physicians that reach out to me. So I've seen it transition, but I've also been a trailblazer in that direction because I value massage so much and I think it can be life changing in the right environment. And it's not just about a luxury experience. It really is there to help improve your quality of life.
Why do you think a lot of people leave this so important part of our personal care down at the bottom of our priority list?
That's a great question. I think that in today's society, we're busy, we're distracted, we're overwhelmed. And I think that it just doesn't become a priority until people wake up and they have a kinked neck or they've had a headache for 3 days or a backache that doesn't go away. I think that because it's an out of pocket expense, it's challenging for people in today's, economic climate. That's one of the reasons why we are a medically approved provider. We accept HSA and FSA, and then now we're about to transition to health insurance. So I think that people tend to neglect themselves until their body is screaming.
Yeah.
And then they're like, I need to get in there. So it's about educating and providing a quality service that provides relief so that they actually want to come back and they see the value in that financial investment and the time investment for themselves as well.
Yeah, definitely. It is an investment for sure. All right, great. So Novum Massage today. Your website, it says that it offers, the medical base massage. For someone who's never heard that term before, what does it mean? Is it like a massage with PhD, or what what makes it
So
stand out?
m- my team is a medically approved provider. So they've gone through a medical massage training certification program. We are trained in an environment that manages pain and chronic pain and acute pain and injuries. So we can accept personal injury when somebody's been in a car accident. We work more side by side with physicians and surgeons where people are coming in for more recovery and rehabilitation and not necessarily a relaxation services. Although we have a minimal of services that fall into that stress management category,
Mhm.
the majority of our clientele are coming in for injury management, pain management, and the rehabilitation. And so for us, that's what that encompasses. And then the fact that we're a medically approved provider, people can now pay for their massages with Blue Cross Blue Shield, TriWest, Carondelet. Those are the providers we're currently accepted in. We'll obviously expand as other healthcare companies expand to massage therapy because for the last couple of decades, they've respected the chiropractic industry, physical therapy, but massage has never encompassed that for insurance companies. And they're really starting to transition and expand into that category. And so as other insurance companies get on board, we will also become providers for that. So it gives the clients the opportunity to have somebody else kind of foot that bill as far as the financial cost, but then they're actually being recommended by a physician or healthcare provider that we are in alignment with professionally.
Right, right. And how long ago did the insurance, started making this change or transition?
It's only been this year, actually in
Really?
2025. Yeah, we actually, TriWest has been around for a while as far as the veteran affairs.
Mhm.
They do pain management and stuff a lot for the veterans. So they've been a trailblazer just providing for veterans. But Blue Cross Blue Shield actually just expanded this year. And then Carondelet was not far behind them. Blue Cross Blue Shield is a very huge organization. So I anticipate all the other insurance companies are going to follow behind that.
Wow, was that a game changer for the practice? I mean, yeah,
Yeah.
Yeah.
Absolutely. I cannot tell you how many people, and we haven't fully launched yet. We're about 3 weeks away, but our phone is just ringing off the hook because people are just amazed that they could actually pay for their massages through their health insurance.
And so once the insurance authorizes that, do they reach out to their customers and then also to businesses like yours to let them know?
Yeah. Absolutely. And then we have a coding and a billing platform that provides a verification link that once we have that up and running, we'll have it available on our website. We'll post it on our social media. And then people can immediately click on that link and just go through a verification process to see if they qualify.
Wow, that's wonderful. That's good to know because I did not know, and I have HSA and I have a medical insurance. So, yeah, you never think that it's going to be covered. That's great.
Yeah. It's a big move for our industry and also for my clinic.